Regulatory compliance in healthcare is all about a healthcare organization's adherence to laws, regulations, guidelines, and specifications relevant to its business processes. Violations of regulatory compliance regulations often result in legal punishment, including federal fines. It is the ongoing process of meeting or exceeding the legal, ethical, and professional standards applicable to a particular healthcare organization or provider. It requires healthcare organizations and providers to develop effective processes, policies, and procedures to define appropriate conduct, train the organization's staff, and then monitor the adherence to the processes, policies, and procedures. Healthcare regulatory compliance covers numerous areas including, but not limited to, patient care, billing, reimbursement, list, managed care, contracting, occupational safety and health administration, Joint Commission on Accreditation of Healthcare Organizations, and Health Insurance Portability and Accountability Act, Privacy and Security.
Good morning, my name is Punitham Lobulathan. Today I would like to present about the goals and objectives of regulatory compliance in healthcare. Let's see about the goals. The first goal is ongoing and accurate training and education for all the employees. The second is keeping up with changes in technology and the associated regulations. Next is maintaining compliance and accreditation with the increased use of cloud providers in accordance with HIPAA. Maintaining accountability at all levels. Applying the appropriate disciplinary measures when regulations are violated. Other than that, changes relating to patient privacy imposed by implementation of the General Data Protection Regulation. Furthermore, developing, maintaining, and updating policies without creating overlap. Okay, now let's see about the objective. The purpose of primary benefit of healthcare compliance is improve patient care. Patient care is improved when healthcare decision is on current clinical standards. Patients' care decisions are based on improper motive rarely results in the delivery of quality care. Healthcare compliance also aids the healthcare organization and providers in avoiding trouble with government authorities.
Hi everyone, today I am going to present about elements. Firstly, establishment and adoption of written policy and procedure to promote the organization commitment to compliance. Secondly, identification and appointment with the organizations of an individual to serve as compliance officer who will be responsible for monitoring compliance effects and enforcing practice standards. Thirdly, establishment of reporting system to encourage individuals to make complaint regarding compliance without fear of retaliation. Fourth one, commitment to conducting formal education and training programs for all levels. Fifth one, ongoing auditing and monitoring of system to assess the effectiveness of the compliance programs and identify issues. The sixth one, development of policy to enforce standards, conduct with disciplinary measures of employers who will fail to comply with requirements. Lastly, when vulnerabilities are identified, corrective action must be conducted in response to contagion violence.
Hi friends and lecturer, my name is Vaitishwari Subbaya. Today I want to present about elements. Okay, let's see that. conduct internal monitoring and auditing. Auditing represent evaluation activities completed by individual independent of the process on a periodic basis. In monitoring represent evaluation activities completed by individual of the process on a routine or continuous basis. Secondly, implement compliance and practice standards. Thirdly, design a compliance officer or contact. A compliance officer is an individual who ensures that a company complies with its outside regulatory. Conduct appropriate training and education. Training is a highly useful tool that can bring an employee into a position where they can do their job correctly. Respond appropriately to detect offenses and developing corrective and action. Develop open lines of communication. Enforce disciplinary standards through well-published guidelines. An effective compliance program should include disciplinary policies that set out the consequence of violating the nursing facility standards of the conduct and policy and procedures.
Hi everyone, my name is Kanisha Ganesan from batch 19. Today I am going to present about the importance of the topic. We all know that healthcare should be offered with the best services possible, but understanding is the existing issues when referring to healthcare complaints issues is not as easy as it may seem. Getting the proper care and the most appropriate treatment under the healthcare reform law can sometimes make the difference between life and death. And there is no wonder that healthcare complaints is considered so important. Healthcare complaints should be found anywhere and professionalism should always show their highest interest for their patient. Improving the quality of life of the citizens of a certain country is also something that should be always be considered by authorized, and healthcare complaints is the first step. In fact, healthcare complaints is required and guaranteed by the law in the United States. Anyway, in the United States, there are certain and very strict rules when it comes to the healthcare issue. Well, the thing you have to know when it comes to the healthcare complaint is that it is not limited to healthcare providers, but the rules under the healthcare complaints are going to affect patients and insurance companies. Some people for private getting services when it comes to getting healthcare, while others divide to get government healthcare insurance. The most important aspect is to choose those services that you can be sure are going to work for you. There are different companies that can be offer you healthcare insurance compliance, and it is very important for you to know all the main offers before making your choice. Healthcare compliance and financial aspect are also some elements that people most likely want to learn about. And there is no wonder that they do, keeping in mind the fact that healthcare is a very important aspect of our lives.
Hello everyone, I am Abhirami Ponnudure from batch 19. I am gonna present you guys about the importance of this topic. When talking about regulatory healthcare compliance, all employees and workers in the healthcare system need to be aware of the laws that regulate the well-functioning of the systems. Anyway, when referring exclusively to compliance in medicines, the word is synonymous with adherence. Although healthcare compliance will describe most of the time the use of treatments that include medication, the rules will also apply to patients who are recommended to follow therapy session or counseling. Patients can be submitted to various types of treatment schemas depending on their issues and the general state of health. And healthcare compliance will regard all such treatments linked to the degree in which patients correctly follow a certain medical advice. Anyway, healthcare compliance will not only refer to patients. Patients and healthcare providers affect the functioning of the system equally. Improving the healthcare compliance will be a purpose that can be accomplished with a positive relationship between patients and their healthcare providers. Insurance companies are also going to be included under healthcare compliance rules. Doctors need to make sure that the house treatment administered is the best one. while patients need to correctly follow their recommendation for the treatment to be effective. Thank you guys.
Hi, my name is Signeshwar Lakitanabalan. Today I am going to present about your finding and subtopic from reference book. My finding and subtopic from reference book: safeguarding privacy and ensuring quality care. The U.S. Department of Health and Human Services Office of the Inspector General is the government wing in charge for protecting patient privacy, ensuring class care, and combating fraud by ensuring healthcare organizations are compliant with federal healthcare laws. The Emergency Medical Treatment and Labor Act ensures public access to emergency service regardless of a patient's insurance coverage or capability to pay. What is more, the Patient Protection and Affordable Care Act and it's the patient protection portion of the act that has questionable had the biggest impact on healthcare compliance. The ACA outlines 7 core elements for organizations to follow in establish an effective compliance program, with the OIG providing the best practice guideline. In addition, medical share saving programs for established accountable care organizations through coordinating patients' care within an association of hospitals and other healthcare providers. The goal of ACOs is to keep costs down and advance patient outcome and in distributing healthcare providers with a pay-for-value model rather than the traditional pay-for-service. On the other hand, administrating these programs take in the enforcement of a web of compliance statutes and reimbursement steps that healthcare organizations must follow.
Good evening everyone, my name is Previnraj Nalakibalu, DM student from batch 19. Today I want to present summary of regulatory compliance for the healthcare sector. Regulatory compliance in healthcare is all about healthcare organizations' adherence to law, regulations, guidelines, and specifications relevant its business process. Violation of regulatory regulation often result in legal punishment, including further fines. It is the ongoing process of meeting or exceeding the legal, ethical, and professional standards applicable to a particular healthcare organization or provider.
Hi, I'm Jasrin Ganesan from TEM Batch 19 and I'm here to talk about the summary of this article. Okay, first of all, this requires healthcare organizations and provides to develop effective process, policies, and procedures to define appropriate conduct, train the organization staff, and then monitor the adherence to the process, policies, and procedures. Healthcare regulatory compliance covers numerous areas including but not limited to patient care, billing, reimbursement, managed care contracting, OSHA Joint Commission on Accreditation of Healthcare Organizations, and HIPAA, Privacy and Security. Okay, thank you.
Hi everyone, I am Darshan Dr. of Murali, batch 19A TEM 061054. Okay, I want to talk about the conclusion. The conclusion and recommendation present below reflect the most critical step that the committee should think be taken to improve the state of healthcare in the home based on the literature review in this report examined through a human factor lens. Thank you.